Senator Smith.
Thank you, Madam Chair and Ranking Member. And thanks, welcome to our panelists. I really appreciate this discussion today. I want to focus in on mental health and the importance, the value of providing good mental health services in schools. This is something that I've heard consistently from parents and students and also educators in Minnesota, even before the pandemic. But of course, the pandemic really exacerbated that challenge. In Minnesota, I'm sure like a lot of districts, we really struggle with finding resources in order to provide this. Minnesota actually has one of the worst school counselor to student ratios in the country. The recommended ratio is 1 to 250 students. In Minnesota, it is 1 for every 654 students. And it's even worse for social workers and mental health providers, psychologists, and so forth. So one of the things that's happened in Minnesota is that ARP funding has been deployed to address this challenge. In Albert Lea, Minnesota, they're hiring counselors and a social worker. In Dover, Iota, they're bringing in outside mental health professionals to try to fill this gap. So, Mr. Russell, and then I'm going to turn to you, Ms. Russell-Tucker. As an educator, could you talk to us about the value, what you see around having mental health professionals in schools to be able to provide fill that need for students, and what difference it makes in the work that you're doing?
Thank you so much, Senator, for that question. There's a great need for that. In my testimony, I mentioned for the first time in my 25 years of teaching, we had a social worker. And what I noticed is the emotional and mental growth of our students were substantial. Our social worker brought in new ways of trying to encourage our students. Our social worker was able to really tap into not only student trauma, but also faculty trauma as well. And from there, it seems as though there's a healing process that is taking place. And so therefore, it's a great need. Even in my teaching, in my classroom, what I noticed as students are more emotional well because of the social worker that we brought in, and students are more able to really focus on the lesson at the moment. So
that allows the sort of the link. Of course, it's just one student. It's not like, oh, here's my emotional wellness self and here's my academic wellness self. It's one person. Everything that I've read has talked about the sort of how there is also a delay social emotional development growth, just as there's been delay in academic growth because of the pandemic. And it sounds like that's what you're seeing as well.
Yes, I am.
Yeah. Thank you. And Ms. Russell, would you like to comment on this from your perspective, what you are seeing as far as the importance of addressing mental health care needs for students in their learning environment?
So thank you, Senator, and that's a passion of mine. Even before the pandemic, we recognized that students had to have their social emotional well-being addressed because that's foundational to learning. And so we made that an investment priority with the ESSER funds that came in, not for just ourselves. And we also realized in Connecticut, so all our districts, as I said, have invested over $183 million across the state. We're also doing it from our state reserve as well. But our legislature just passed landmark legislation on mental health that is also providing additional resources for schools to be able to hire mental health staff and others that they need, assess what they need at the local level. It is critical for students to learn. And it's also critical for staff when we talk about the environment that they're working in, that their needs are also met. But if their needs are met, then they can also focus on teaching and learning.
Thank you. I couldn't agree more. I think this is an area of very important focus for us. And I want to just note that not only has this committee just is in the midst of doing really important work, marking up and working on a mental health, broader-based mental health legislation, but in the package that we just voted on for last night, we're also looking, as we look at gun safety issues, also looking at mental health issues and what we can do to support that. I think that that's a very important priority. Maybe just quickly, Mr. Russell, before I run out of time here, I also believe that strong after-school programs are incredibly valuable to help to support students and kids. We are seeing how rescue plan dollars were used to extend after-school programs. My colleague on this committee, Senator Murphy, has worked a lot on this, and I've been glad to partner with him. Could you just have a minute to talk a little bit about how those after-school programs also can be helpful to advancing kids' social, emotional, and academic growth?
Thank you so much again, Senator, for that question. Yes, it has been a great, great benefit to our school district. Because of the ESSER fund, we was able to create and to enhance our after-school enrichment program. Our program goes from after school to around 6 in the p.m., maybe 3 hours a day. What we bring in are tutors, but at the same time, we bring in recreational activities, just in order for our kids to be kids. And what I noticed is that that after-school program has really benefited our school. As I said earlier, in regards to bringing the social worker, the after-school program has been a direct link into our emotional well-being of our students as well.
Thank you very much. Thank you, Madam Chair.
Senator King.